The CDC reports skin cancer is the most common type in the U.S., and while it's usually treatable, patients are often left with scars.
Reporter Kari Beal has insight into a treatment option that claims to zap cancer cells without leaving a permanent mark.
Because I'm outdoors all the time.
Like many of us, Peyton Howell says he probably spent too much time in the sun. When he went in for an annual checkup, his doctor noticed a spot on his nose.
I did not have an idea, so that's another reason, go see your dermatologist.
After testing, Dr. Elizabeth Dunleavy determined he had basal cell carcinoma.
Oh, good to see you.
But instead of surgery, the common treatment, she recommended a type of radiation called image-guided SRT.
It uses a low-energy X-ray that only penetrates a certain depth into the skin. So the importance of that is you're not damaging surrounding tissues, you're not damaging deeper structures like you can do with the external beam radiation, which is different.
This is why patients usually don't have scarring, but it's only for people with basal or squamous cell skin cancers.
And you need to have a cancer that is actually of a depth that this technology will penetrate to the level of the tumor. If it's bigger and deeper than what this can reach, it's not the best treatment.
Radiation therapist Michelle Padilla gave a demonstration of how it works. First, they use an ultrasound to precisely identify where the cancer is.
Skin is clear,
The skin is clear. She has nothing there. The top layer of her skin, beautiful, colorful cells, right?
Then they administer the radiation.
So this would just rest right on that.
No pain during that time. There's no, there's no after effects. So it's really a very, very simple procedure.
The procedure involves 20 sessions.
You actually sit down in this chair and you're here probably less than 10 or 12 minutes.
And Howell says he did have to wear a Band-Aid on his nose for a few weeks, but the end result was worth it.
And where that cancer was here, it's filled in with new normal cells.
A study on the procedure showed a 99% cure rate.
You get through that and wear a little humility there, but it's, to me, it was so much worth it to be able to come back and literally my results were fantastic. Literally no more cancer on my nose.
Dr. Dunleavy says this procedure is not ideal for people who have had radiation to the same area in the past. A patient cannot have hair on this spot, so this includes a beard or a mustache. Anyone who has a sun sensitivity may not be ideal for the procedure either. In Greenville, South Carolina, I'm Kari Beal.